Coronavirus, also known as COVID-19, is an infectious disease caused by a newly discovered coronavirus. Most people infected with the COVID-19 virus will experience mild to moderate respiratory illness and recover without requiring special treatment. Older people and those with underlying medical problems like cardiovascular disease, diabetes, chronic respiratory disease and cancer are more likely to develop serious illness. The best way to prevent and slow down transmission is to be well informed about the COVID-19 virus, its causes and how it spreads. Every member of the clinic team must read and comply with the guidance set out in the COVID-19 Clinical Directive. Protect yourself and others from infection by washing your hands or using an alcohol-based rub frequently, and by not touching your face. The COVID-19 virus spreads primarily through drops of saliva or discharge from the nose and mouth when an infected person coughs or sneezes, so it's important that you also practice respiratory etiquette, for example, by coughing into a flexed elbow or catching a sneeze with a tissue. Maintain a distance of at least 2 metres between individuals wherever possible. Ensure only one member of staff is behind reception desk at any time. Wherever possible, objects that can facilitate the spread of COVID-19 should not be used by multiple members of staff or patients. PPE must be worn by all staff members. The level and type of PPE will be appropriate to the role requirements of the staff member and in line with government and public health recommendations. Soap, water and hand sanitizer stations should be clearly visible to all staff members and patients. Wherever possible, use soap and water. Evidence suggests the virus can exist for up to 72 hours in surfaces. Door handles must be disinfected hourly, with communal surfaces in the workplace disinfected every 2 hours. Seats in the waiting area must be spaced by a minimum of 2 metres apart. Approved signs should be placed on seats that are not to be used. The waiting area should be free from magazines, newspapers, coffee and tea machines. Pre-dispensing a selection of frames should be encouraged to allow the optometrist to take the associated dispense measurements at the end of their eye examination. The patient must wash or sanitise their hands before trying on a glasses frame. After a patient has touched a glasses frame, it must be wiped down with a disinfectant wipe before being reapplied to the display. When receiving deliveries, maintain social distancing and where possible, use your own pen to sign for the delivery. If an electronic signature is required, sanitise your hands immediately after you have signed for the delivery. Request and record the details of the delivery driver, including organisation, name and contact telephone number. By following the guidance set out in the COVID-19 Clinical Directive, you are helping to create a safe environment to protect your health, the health of your colleagues and the health of Optical Express patients.